Hi everyone, a beautiful day today. My name is Dr. Anand and today we are here in Pediatrics. The topic is cardiology. The topic is acute rheumatic fever or rheumatic fever. Before starting any segment, we always have a quote, and the quote for today is: no one cares until you are rich, famous or frustrated. No one really cares until you are rich, until you are famous or until you are frustrated. We always think, are dependent on people. We are dependent on society, dependent on people. In Hindi, there is a beautiful quote which says के क्या कहेंगे लोग, ये है सबसे बड़ा रोग. क्या कहेंगे लोग, ये है सबसे बड़ा रोग. What people will talk about. What people will talk about my clothes, about how I look, how I talk, behave, walk. In Hindi again we say लोग तो भगवान से भी दुखी हैं, तुम क्या चीज़ हो? People are fed up of God only. Who are you? So that's why don't get carried away by people and situations. What do you feel is right? You do that. Today's topic of choice is acute rheumatic fever. Now, rheumatic fever, very importantly, there's a very beautiful quote. It licks the joint and bite the heart. It licks the joint and bite the heart. In rheumatic fever, basically, it attacks on your joints, gonna cause you arthritis, and basically bites your heart. Attacks on the heart, gonna cause a murmur. Now, very importantly, one thing you should know. Yeah, this is a very logical straight 3 PY previous year questions. Which is the most common congenital heart disease in full cardiology? The most common congenital heart disease in full cardiology is a ventricular septal defect, number one. Number two, which is the most common acquired heart disease? Acquired means one is congenital, one is acquired. Acquired heart disease means birth, no problem was there. After 10-year-old child got a heart murmur. So the most common acquired heart disease is acute rheumatic fever, the one we are studying right now. Acute rheumatic fever or just rheumatic fever, you can say. The most common acquired heart disease in developed country in Japan and all that, Kawasaki disease. Very importantly, please remember Kawasaki disease is the most common congenital heart disease or acquired heart disease in Japan or other developed countries, but not in India. In India, it is acute rheumatic fever. Now, this is an immunological disorder. Immunological disorder basically caused by GABA. What is GABA? Group A beta hemolytic streptococci. Basically, in this condition, it causes antigenic mimicry. It causes antigenic mimicry. Means, for example, if I have got a cough and cold, what will happen? Imagine this streptococci has come into my body. I got cough and cold. Imagine I got this streptococcus infection. Okay, so this is like a enemy, this is like a antigen. So what my body will do, my body will make antibody against the antigen. So I'll take a tablet amoxicillin or some antibiotics and I'll be fine. So now my antibody will kill the antigen, but now what will this antigen will do? They will change their phase and they will cause antigenic mimicry. Means they will change their phase which is exactly looking like my heart. They will change their face, their body structure, which basically mimicking the heart. So my antibody also attacks on the antigen but gonna also attack on my heart, like that. These antigen change their face and becomes like my joint. So this antibody gonna attack the antigen, but it will go to the joints also and gonna attack my joints, like an antigenic mimicry. This is known as antigenic mimicry. Antigen and the real body structure, like things, it looks alike. Okay, so I'm giving you a hypothetical example. Imagine this way it happens, and that is known as antigenic mimicry. So that you should know. The main pathology I told you is antigenic mimicry. 5 to 15 year is the most common age group for acute rheumatic fever. This is important for exam purpose. In your MCQ, it will be a 10-year-old boy came with complaints of this problem. So That is one thing you should know. Number one. Number two, very importantly, if you talk about the male is to female ratio, it is equally affected. It is equal. The male is to female ratio, it is equally affected in a case of what you call rheumatic fever. Now, what are the clinical features? The clinical features, very important, how the story will start. That's what streptococcal pharyngitis. I'm going to have a cough and cold with fever. 10 days to few weeks later, by reoccurrence of fever and manifestation, I'm going to have a cough and cold and I'll take antibiotic. From that 10 days to few weeks later, again I'm going to have a reoccurrence of fever and other manifestations. Okay, now very very important what you should know for exam purpose, that is nothing but something known as, we use a criteria for acute rheumatic fever, that is revised Jones criteria. Number one, MCQ. It is divided into major criteria and minor criteria. It is divided into major criteria and minor criteria, and each major and minor criteria, they are subdivided into low risk population and moderate to high risk population. Low risk population and moderate to high risk population. I'll repeat again. Acute rheumatic fever, we have a criteria known as revised Jones criteria. It is divided into major and minor criteria. Major and minor criteria are subdivided into low risk population and moderate to high risk population. And most importantly, what I want you to remember, the every inside component, like points of low risk, points of high risk, that is not important, but five main components are important. Number one, you're gonna have carditis. Second, arthritis. Third, very importantly, you can say third will be chorea. Fourth will be erythema marginatum, and five will be subcutaneous nodules. This I want you to remember. Okay, number one, carditis, arthritis, chorea, erythema marginatum, and subcutaneous nodules. Carditis, arthritis, and chorea, erythema marginatum, and subcutaneous nodules. Now remember, E for early feature. These are the early features. Okay, it will be a 5-year-old boy which will complaints of arthritis. That's how the MCQ will start. Clinical feature also. The first thing you will write is arthritis. 5-year-old boy came with complaints of arthritis. On further examination, once you auscultated, the patient will have carditis. Carditis also is a early clinical feature. I'll repeat again. 5-year-old boy came with complaints of arthritis. On further examination, if you know what you called auscultate, the patient is going to have a murmur, nothing but arthritis, carditis. So arthritis and carditis are the early clinical feature. Once you expose the chest of the baby, you're gonna have rashes over there, known as erythema marginatum. Known as erythema marginatum. These also are early clinical feature. Rest, chorea, and subcutaneous nodules are late clinical feature. 5-year-old boy came with complaints of arthritis. On further examination, he had a murmur in the heart. On examination on the chest, he's gonna have rashes. So arthritis, carditis, and erythema marginatum are the important, remember, early clinical features. Very beautiful picture, dreams. Okay, sometimes we are angry, frustrated, don't want to work, feel so tough and tired, but we have to do it, take break, but do it. Then we have minor criteria. Minor criteria also same as I told you, it is divided into low risk population and moderate to high risk population. Okay, in low risk population, the criteria are polyarthralgia, fever, ESR elevated, and prolonged PR interval. Just remember, polyarthralgia, fever, how much and all that, forget it. Polyarthralgia, fever, ESR elevated, and prolonged PR interval. In moderate to high risk population also same, arthralgia, fever, ESR, and prolonged PR interval, but the values are changed, but not important so much for theoretical purpose. At least pointer you should know. Polyarthralgia, fever, ESR elevated, and prolonged PR interval are the minor criteria, very importantly, for the acute rheumatic fever. Now very importantly, number one which you should know is so very importantly we talk about, yes, exactly. So number one, I would like to talk about arthritis, because that is the first clinical feature. 5-year-old boy came with complaints of arthritis. Now this will be a migratory polyarthritis. Migratory polyarthritis, it will be a fleeting type of arthritis. Migratory means joint to joint, multiple joints are involved. Poly means P for પાંચ. Five or more than five joints are involvement. And fleeting means, so I'm gonna have a swelling over in this joint. After 3 days, this is fine. I'm gonna have a swelling in the wrist. Now after 3 days, wrist is fine. I'm gonna have a swelling on my knee joint. So migratory, one joint to one joint. Fleeting type of polyarthritis, very importantly, you see in a case of this one, what you called this one, acute rheumatic fever. So yeah, polyarthritis, yeah, five or more than five large joint are involved. Knee, ankle, elbows, these joints are involved. Now very importantly, if we talk about the carditis, okay, if we talk about the carditis, we all know that carditis occurs in 90% of patients, because I told you, like 5-year-old child came with complaints of arthritis. On further examination, he is going to have a murmur in the heart. Okay, and some patient, indolent carditis could be a late feature. Indolent means asymptomatic. Normally you will see a murmur only, but indolent carditis, like a asymptomatic, what you call the carditis, the patient can have. So these are the beautiful points you should know. Number one is arthritis, number two is carditis, number three, very importantly, which I want to show you, what was the third thing was, very importantly, third thing was erythema marginatum. So you go by hierarchy, okay? Arthritis, migratory, polyarthritis, fleeting type of arthritis. Number two, carditis, 90% it is seen, and sometimes could be indolent carditis, nothing but asymptomatic carditis. Third, we have erythema marginatum. Yes, we know it is an early clinical feature. Now, yes, it is seen in the trunk area, chest and trunk area, you can see. This is serpiginous rash. It's a serpiginous rash. Serpiginous means snake-like. Serpiginous means snake-like. It's like the way snake, like goes like this, like this, like this. So serpiginous, like a snake-like appearance you're gonna have. Basically, mainly they see on the trunk, so that you should know that is a serpiginous rash. Let's revise again. Acute rheumatic fever, what is the name of the criteria? Revised John's criteria. It is divided into major and minor criteria. Major and minor are subdivided into low risk population and moderate to high risk population. The first early clinical feature will be arthritis, second is carditis, and third is erythema marginatum. And the two late clinical feature, very importantly, are what? They are very importantly are the subcutaneous nodules. Subcutaneous nodules, number one, very importantly, it will be on the, yes, it will be, they are the non-tender. The subcutaneous nodules, they are the non-tender nodules, small nodules are there. Okay, nodules are there on the bony prominences, on the chin, on the elbow, on the shin bone, that is a tibia and spine. So these all things are the late clinical feature. And very importantly, last but not the least, something known as Sydenham's chorea. Okay, so this also is a late clinical feature, Sydenham's chorea. This patient, basically, she's gonna have I'll tell you one very nice, she's gonna have a milkmaid grip. She's gonna have a milkmaid grip, and she's going to have a darting tongue. Milkmaid grip and darting tongue. What is milkmaid grip? While taking the milk of the cow, I'll squeeze one nipple and release one nipple. I'll squeeze one nipple, release one nipple, squeeze and release, squeeze and release. So if I tell the patient, if I tell the patient to hold my finger, if he holds my finger, he will squeeze, release, squeeze, release, squeeze, release, like that. He will hold my finger, squeeze, release, squeeze, release. He'll not continuously holding like that. So this is known as a milkmaid grip. Or second, importantly, you can say darting tongue. What is darting tongue? How do you put darting? So like if I show your tongue, so instead of showing like this, normally he will show like that. So like that, darting tongue he will show. Okay, so that is one thing you should know. Now very importantly, number one, over. Now, what is the treatment and investigations? What about the lab results? So we all know that number one, TLC will be on the higher side, and ESR, CRP also will be elevated. Prolonged PR interval and ESR was elevated in minor criteria. So TLC will be on the higher side, 10 to 15,000 cubic per millimeter, and ESR and CRP are elevated. Number one. Now, what is the treatment? Now, treatment is quite interesting. Let me show you this, a very beautiful picture. Number one, very importantly, common things are common and rare things are rare. Simple bed rest. Why simple bed rest? Because murmur is there, no? Arthritis, pain is there in the arthritis, and here it is a murmur. Okay, so please, number one, take rest. Number one. Number two, yes, we're gonna give benzathine penicillin injection. This benzathine penicillin injection intramuscular every 21 days. We're gonna give every 21 days. They are deep intramuscular painful injection, okay, which are milky white in color, which are milky white in color. This also question they ask in exam, what is the color of benzathine penicillin injection? Milky white in color. Okay, so that is one thing you should know. Okay, so yeah, so it is according to weight wise, less than 30 kg and more than 30 kg. Less than 30 kg will give 6 lakh international units, and more than 30 kg we will give 12 lakh international units of benzathine penicillin intramuscular, deep on the buttocks, deep IM. It's a painful injection. It is a milky white in color. So these are the happy thing you should know. One more question I want to show you, which they ask in the exam, is like when to give this injection. This is like very important. If the patient, like for how long the treatment will go, this is very interesting. If the patient has rheumatic fever without carditis, there is a rheumatic fever without carditis, murmur is not there, but polyarthritis, erythema marginatum, all these things are there. So rheumatic fever without carditis, then this benzathine penicillin, this will go for 5 years or until 21 years of age, or until 21 years of age, whichever is longer. Whichever is longer. Okay, remember that. I'll repeat again, rheumatic fever without carditis, the treatment will go for 5 years or until 21 years of age, whichever is longer. Okay, for example, Rahul, I have a patient, is a 7-year-old boy with rheumatic fever without carditis. For how long I should give injection to Rahul? According to first point, till for 5 years, means 8, 9, 10, 11, 12, 13. Till Rahul is a 13-year-old boy, means for the next 5 years, I will give him injection. Or the second line is written until Rahul is 21 year of age, but the last line is whichever is longer. Whichever is longer. What do you think? 13 is longer or 21 is longer? So 21 is longer. So Rahul is a 7-year-old boy, rheumatic fever without carditis. He will be given every 21 days injection till 21 years, till he is 21 years old. If the patient is rheumatic fever with carditis, then the double, then treatment duration for 10 years I will give injection to Rahul, or until Rahul is 21 years of age, whichever is longer. Okay, if the patient is rheumatic fever with carditis with residual heart disease, okay, there's some defect or some kind of this is the question, which is the heart valve involved most commonly in acute rheumatic fever. The mnemonic is MAT. The mnemonic is MAT. It is the mitral valve which is involved, followed by the aortic valve, and followed by the tricuspid valve. MAT is the mnemonic for this one. Remember this. So if the patient has rheumatic fever with carditis with mitral regurgitation or some residual heart disease, then the treatment will go till 10 years or until 40 years of age, or until 40 years of age, whichever is longer. So this is the very classical MCQs they ask in exam. Rheumatic fever without carditis, the treatment will go for 5 years until 21 years of age. Rheumatic fever with carditis, now the treatment will go for 10 years or until 21 years of age. Rheumatic fever with carditis with residual heart disease, the treatment will go for 10 years, treatment will go, or until 40 years of age, whichever is longer. Okay, that you should know. Patient with established rheumatic heart disease or following a valve surgery. Yes. Now, do you want to change any treatment for the one who has from last 20 years he's having rheumatic heart disease, or he is following a valve surgery, the mitral valve has gone totally damaged, the valve surgery is there. In that case, to Baba, every 21 days injection, lifelong you'll give. Okay, but don't give after 40. Okay, after 40 you don't give. Why you don't give after 40? Because the likelihood of reoccurrence of acute rheumatic fever and rheumatic heart disease is very rarely after 40. Number one. Number two, acha, this I have told you, benzathine penicillin, less than 30 kg 6 lakh, more than 30 kg 12 lakh IU. We have penicillin V also. If you want to give orally, you have penicillin V 250 mg orally twice a day BD you can give. Okay. Yeah. If the patient is allergic to penicillin, then erythromycin. Okay. First is benzathine penicillin, then we have penicillin V, and the patient otherwise erythromycin. Penicillin V and erythromycin, these are oral, and benzathine penicillin, that's a proper injection. So BPE, benzathine penicillin, penicillin V, and E for erythromycin macrolide. Remember that mnemonic, BPE. Examiner will be very happy. So that's it. This was the question. Okay. A 5-year-old child with cough and cold was given antibiotic for 7 days. That's how the story starts. Cough and cold was there. Streptococcus has entered. Now I have killed streptococcus by giving antigen. But little bit of streptococcus antigen is still left, and he has done antigenic mimicry. So now the antibody is going to attack the streptococcus as well as antigenic mimicry, as well as my heart also is going to attack. On further follow-up, the patient had elevated ESR with polyarthritis, means the patient has acute rheumatic fever with no feature of carditis. That's important. So that for the question is now prophylaxis for how long the treatment will go. So we all know that the treatment will go for 5 years or until 21 years of age. Injection benzathine penicillin every 21 days IV for 5 years or until they are 18 years of age. So 18 years of age. So now, okay, whichever is later. Okay, one thing until. So now before in the guidelines was 18 years of age, but now we have done 21 years of age. So now the best answer for this one will be or until 21 years of age, whichever is later. So injection benzathine penicillin every 21 days IM for 5 years or until they are 21 years of age, whichever is later, because the patient has rheumatic fever with no feature of carditis. Okay, so yeah, that is one thing I would like to mention over here. And 5 yeah, so this is something we will do over here. That's it. So in this one, yes, so 21 years of age, whichever is longer, that will be the better answer. And still, if I say 18 years was written, then I would have chosen none of the above as the right answer. So that finishes this class. Thank you so much, everyone. That finishes the important pointers also over here. And remember, don't work hard, work intelligent. Don't work hard, work intelligent. Okay, he's working so hard, working so hard, working so hard, working so hard, but I think smart work is really important. Think about it. This is a huge logic of life, so think about it. Please take care and thank you.